Impact of hands-on technologist training on image quality. Let's see if I can get that. So although there have been many significant changes in technology and mammography over the past couple of decades since the passage of MQSA, including the introduction of full-field digital mammography and digital breast tomosynthesis, one aspect of mammography that hasn't changed and remains to be critically important is patient positioning. Positioning is so important because we can only evaluate what we can see on the image. And so if we don't have it on the image, cancers can be missed. And in fact, in 2015, the FDA published this article showing that poor positioning was responsible for most clinical image deficiencies and failures. 92% of first attempt clinical image deficiencies were due to positioning. And this was information that was published by the American College of Radiology in 2015. Despite our best efforts and numerous articles being written on the importance of positioning, very little has been done to provide technologists for opportunities for improvement. We continue to have too many repeats, rejects, and recalls, and there's really very little data that have been published on these issues. As I mentioned, technology has changed dramatically over the past 20 years since film screen mammography. And with equipment changes, there's been challenges that we have with positioning the patient. The image receptor and the phase shield have both increased in size. Technologists have had to adapt to these changes in technology, yet they haven't really had any new updated positioning training. So now is the time to make an effort to establish, improve, and maintain quality in mammography. Most industries have established standardized methods of performance to establish and maintain quality, reduce errors, increase productivity, increase customer satisfaction, increase profile, and reduce the possibility of litigation. In general radiology, technologists are taught to perform all exams using standardized techniques, to perform all exams in the same sequence, that training is competency-based, and that their skills will be evaluated on positioning techniques as well as clinical image evaluation. But not in mammography. Most technologists do not practice a standardized method of positioning. In fact, we interviewed technologists throughout the United States, and over 80% of them said that they do not practice a standardized, or that the technologists in their practice do not position the patients in the same way. And there are consequences to this. Most technologists know what they need to see in the images, but they haven't been taught how to correct positioning problems. Most technologists have not been taught a standardized method of positioning. They haven't been taught by a qualified trainer, and clinical images are evaluated subjectively. So how did this happen? Well, most of the technologists are getting their continuing education credits online. There's no CEUs for hands-on positioning that are required. And the initial 25 nanograms are required, but under whose supervision? There's no requirements for the qualifications for the technologist that is supervising the new technologist. As I mentioned, most of the CEUs are online, and the radiologists are passing inadequate images, and they can only give subjective feedback regarding positioning criteria. Unfortunately, updated positioning is usually not provided by an employer until they're cited by the American College of Radiology. Facilities are not aware that there's published data on how to establish parameters for positioning criteria. And most materials that we have are outdated in positioning for full-field digital mammography and digital breast tomosynthesis. So the outcomes are that we've got more repeats and rejects. We have more callbacks, unnecessary patient anxiety, radiation exposure, inefficiencies, and on-the-job training injuries because we're using techniques that aren't ergonomically sound. So our suggestion is that with a combination of updated standardized positioning training, in addition to objective measures for image analysis, that we can improve image quality and find cancers earlier. So let's first talking about standardized positioning techniques. Do they actually work? Well, they've been used in Sweden for over 40 years. They were taught by the ACR in the 1990s, but there's been no update since. The results have been published by Bassett and his team at UCLA, And there's current preliminary data regarding standardized positioning techniques that's very impressive. So in 1993, Dr. Bassett and his team at UCLA evaluated 2,000 film screen mammograms and created a standard for excellence in image quality in mammography. After the technologist received standardized positioning training, the overall improvement in image quality was 68%. In 2012, at Northwestern University, they received updated standardized positioning. And after the standardized positioning, there was a 50% reduction in technical callbacks. And this is really important because technical callbacks increase radiation exposure to the patient, they're not revenue producing, and they also dramatically increase patient anxiety. So what's the current data show? Well, there's a study published from the University of Kansas Medical Center in 2017, this past December, an AJR, that evaluated positioning in full field digital mammography and digital breast tomosynthesis as compared to film screen mammography positioning standards. What they found is they looked at measured improvements in ACR standards and positioning as compared to improvements that were measured in the Bassett study that was done in 1993. Despite the new challenges in positioning with full field digital mammography and digital breast tomosynthesis, including the increased size of the image receptor as well as the phase shield, they saw a greater improvement in the image quality after standardized positioning than they did in the Bassett study, where standardized training was led by an ACR team. They were able to show the effectiveness of updated standardized positioning techniques, and they were also able to set reasonable standards for positioning criteria to be met with full field digital mammography and digital breast tomosynthesis. At Mammography Educators, we provide on-site, hands-on positioning training. It's updated standardized positioning training, and we use a method called the Miller method. This is a data-proven technique that is based on the principles of consistency, reproducibility, proficiency, and proper use of body ergonomics. It's based on the principles for general X-ray and uses correlational anatomy so the technologists better understand how they're able to identify areas for improvement. This is also the technique that is shown in Volpara Enterprise in the embedded training videos. Here are just some clinical images before and after our standardized training, and you can see how significant the difference is in image quality as we're getting almost 1 to 3 centimeters more breast tissue following the training. So what do we need to do? Well, we need accurate methods for determining the actual number of images taken. We need current data for reasonable expectations regarding clinical image evaluation. We need to establish updated, standardized positioning techniques, and we need accurate and objective methods for analyzing the positioning standards, and also the ability to provide feedback and corrective action plans for improving them. So Volpara Enterprise came along and was pretty much our dream. Automated quality assessment software that facilitates and enhances tracking and trending of changes in image quality. It assesses positioning on every single mammogram, and it provides the daily statistics to chief technologists to drive additional training as needed. It's consistent and provides objective evaluation of each image. It aids in the tracking for FDA's EQUIP initiative and also drives stronger quality programs. In addition, we've got the embedded training videos that we incorporated into their software that provides immediate feedback and also corrective action plans so that the technologists know how to fix their problems. So where this was kind of the traditional model of training, we'd come in and we'd hold our on-site positioning training, and maybe a couple of years later, they'd come back and train the new techs and do a refresher training, and the cycle will continue. The new model provides continuous feedback. So we've got an on-list, seamless feedback system where we can evaluate how technologists are doing, how they're improving, and we can update and customize our positioning training based on the needs of each site and each technologist. This was a poster presentation actually by Boca Raton Hospital, Regional Hospital, that was presented at the National Consortium of Breast Centers Conference in 2018. And they saw significant improvements in image quality following standardized positioning with mammography educators. They were able to use Volpara Enterprise for automated software to track changes in image quality and evaluate a very high volume number of images across multiple sites and multiple technologists. So what's next? Well, we're proposing customized positioning training using Volpara Enterprise, targeting programs to address specific technologist challenges and maintain a standardized technique. And, Volpara and mammography educators, we've really teamed up to have innovative technology and training solutions together, and we're both committed to have this collaborative relationship using objective methods where our ultimate goal is to improve image quality and find cancers earlier. We really feel that it's all our responsibility to make sure that all women receive the very highest quality mammogram that's achievable. And this past year, our work became really personal as my dear friend and colleague and business partner, Louise Miller, was diagnosed with breast cancer. And that's her in the pink truck with the arrow. We're thrilled to say that she's currently cancer-free, and it just makes the work that we do even more meaningful every single day. No one ever really thinks they're going to be the 1 in 8 women that gets breast cancer, and especially someone who's dedicated their entire life to breast cancer screening. And it's an important reminder to us that breast cancer doesn't play favorites, and that the work that we're all doing every day is saving women's lives. So thank you all for the work that you do. Thank you for listening to me, and feel free to contact me anytime. I'm